high reliability really starts with making sure that safety and quality are our true north. This is important for us. We are not a reactive organization, but we are a proactive organization where this is important, and we are going to make sure that we have systems in place so that no harm reaches the patient. I can give you an example of my time when I was co-chairing the Enterprise Sepsis Steering Committee for Cleveland Clinic as an organization. And we really wanted to make sure that if there was a patient who was either came into the emergency room as septic or developed sepsis in the hospital, that they would get the same standard care, irrespective of whichever emergency room they walked into or whichever hospital they were currently admitted at, where our sepsis order set looked the same, our sepsis protocol looked the same, our expectation around time to antibiotic administration should be less than 60 minutes is the standard that we were going to hold everybody to. When we are in the ED, that we're going to have a overhead sepsis alert so that the team really circles the patient and gets the workup started and the blood culture is drawn and the antibiotics given in time. Those are the things I think, like if you hardwire that, if you help people understand what the importance of doing the right thing in a timely manner is, and then do it consistently day over day, month after month, year after year, that is what builds that culture of being a high reliability organization.
And you mentioned culture. What are the primary elements of a culture that promotes high reliability?
It is consistency. It is role modeling that behavior across the organization. I like to tell people culture is like putting the shopping cart back when no one is looking. I think that it's more palpable than sometimes what I'm being able to articulate. When people just know this is the right thing to do, and because that is what they have seen around them. That people will always go above and beyond. We're thinking beyond our swim lanes, because at the end of the day, we're putting the patient at the center of this. We're imagining, what if this was me or one of my family members in this bed or in this clinic, and what if I was in that person's position? What would I expect? How would I expect that interaction to be in the hospital? I feel that is culture.